Our total hospitalization rate is down again. You see this curve. We talked about it on the way up, which was a painful journey. We talked about it at the quote-unquote apex, which turned into more of a plateau, a flattening. And now we're seeing it gradually decline. We would have liked to see a steeper, faster decline, but this is where we are, and it's a painfully slow decline, but it's better than the numbers going the other way. You see it on total hospitalizations, you see it on intubations, and you see it also in the number of new cases per day. This is important because while we're seeing that hospitalization rate go down, and you see the number of new cases going down, those number of new cases are still problematic, right? So it means 600 new cases yesterday. With everything we've done, we still have 600 new cases yesterday, either walking in the door to hospitals or people who are in hospitals who were then diagnosed with COVID. But that number is also going down. One of the most stubborn situations and the most distressing are the number of deaths, and that is down from where we were, but it's still 232 yesterday, which is an unimaginable and painful reality that we have to deal with. And when people talk about how good things are going and the decline and the progress, that's all true. It's also true that 232 people were lost yesterday, and that's 232 families that are suffering today. The answer to the question, how do we reopen, is by following facts and data as opposed to emotion and politics, right? Everyone has emotion. I want to go back to work today. I want to go see my family today. I want to be able to go to a bar and have a couple of drinks and socialize with my friends today. I do, by the way. But it's not about emotion. It's not about political position on reopening. There's no Democratic position, Republican position. This virus kills Democrats, Republicans. There's no politics to this. Deal with facts and deal with data. And use that to instruct you, even more important at a time of high emotion. Understand the emotion, appreciate the emotion, but deal on the facts and the data. And you have it. You can calibrate by the number of hospitalizations, the infection rate, the number of deaths, the percentage of hospital capacity, the percentage that you're finding on antibody tests, the percentage you're finding on diagnostic tests, positive, negative. You're collecting tracing data. Make your decisions based on the information and the data. That's what we're saying in New York. That actually works. And by the way, we know it works. When you look, there's a chart today that was published by the New York Times. You look at what's happening in New York, yes, our line is going down. Our number of cases is going down. We have turned the corner, and we're on the decline. You take New York out of the national numbers, the numbers for the rest of the nation are going up. They are going up. To me, that vindicates what we're doing here in New York, which says, follow the science, follow the data. 18% of the people came from nursing homes. Less than 1% came from jail or prison. 2% came from the homeless population. 2% from other congregate facilities. But 66% of the people were at home, which is shocking to us. Disproportionately older. But by the way, older starts at 51 years old. I'm a little sensitive on this point. But if older starts at 51 years old, then that's a large number of us old folk in this state, in this country. So that whole vulnerable population being old, well, old is now 51 and up. So think about that. Transportation method, we thought maybe they were taking public transportation, and we've taken special precautions on public transportation, but actually no, because these people were literally at home. 2% took car services, 9% were driving their own vehicle. Only 4% were taking public transportation, 2% were walking. 84% were at home, literally. Were they working? No. They were retired or they were unemployed. Only 17% working. So that says they're not working, they're not traveling, they're predominantly downstate, predominantly minority, predominantly older, predominantly non-essential employees, and that's important. We were thinking that maybe we were going to find a higher percentage of essential employees who were getting sick because they were going to work, that these may be nurses, doctors, transit workers. That's not the case. And they were predominantly at home. So now that's only 3 days. That's just about 100 hospitals, 1,000 people. But it reinforces what we've been saying, which is much of this comes down to what you do to protect yourself. Everything is closed down. Government has done everything it could. Society has done everything it could. Now it's up to you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.